A very good evening. I'm Catalina coming to you from a remote location in New York City. This is the Thursday night edition of Vision of Asia South Asian News segment. We are continuing our ongoing special report of the coronavirus pandemic, steps and measures. The death toll across the nation today has risen to nearly 94,000 with at least 1.5 million cases of COVID-19 impacting every state of this country. The novel coronavirus has infected globally more than 5 million people and has killed 329,000. Quite a sobering moment as we grapple with both economic and healthcare ramifications of this disease. This is the 9th week now of unemployment claims in millions here in the United States, with talks of another stimulus bill. All 50 states are partially now reopening, with much focus on sustaining social distancing and public safety. New York, where we are coming from, will open its beaches this upcoming Memorial Day weekend, however, with social distancing restrictions and other measures. Also today, New York Governor Andrew Cuomo stated that the state is now investigating 157 cases of an inflammatory syndrome in children that has been linked to COVID-19, and again urged all to take all necessary precautions and follow state guidelines on the coronavirus. We have tonight much on New York being the epicenter of COVID-19 and the implications of that on the immigrant community, as well as much on the food and restaurant industry during the pandemic. Here are the headlines. New York State Assemblywoman Catalina Cruz addresses South Asian and immigrant community, New York. Chef Maneet Chauhan on restaurant industry during coronavirus pandemic, Nashville, Tennessee. ITV Gold exclusive featuring Indian American singer Lisa Mishra on COVID-19 relief efforts, India. A lot more on the other side of the break. Stay with us in Vision of Asia. Voice of the Community will be back shortly. Welcome back. I'm Diti Lama and this is Vision of Asia special report on coronavirus impact, measures and updates. Beginning the show, we have an ITV Gold exclusive featuring renowned chef Maneet Chauhan, who joined us for a virtual interview from Nashville, Tennessee. The Indian American chef and TV personality has been associated with some of the biggest American food TV shows, especially as a judge on Chopped. We spoke with Chef Maneet Chauhan in detail about the impact of COVID-19 on the food and restaurant industry. Restaurants and several food businesses need volume and traffic to run and are the avenues for socializations and interaction, something that is truly affected by this pandemic. What is the future of restaurants in terms of customer care and safety? And what needs to be prioritized as states across the country reopen? Let's take a look at what Chef Maneet Chauhan shared with us while urging all to stay resilient and strong during this pandemic.
In terms of discussing food insecurity, that's such a huge project for each state right now. We're talking about so much unemployment. Food insecurity is actually a direct result of it. What have been some of the challenges of the restaurants in helping with that? And also just the challenges with, again, going curbside, with reopening as such a big focus now. Where is the focus and the challenges?
I think the biggest focus and the challenge is that we need to make our immediate community stronger, right? I have reached that stage where I realize that a big problem like food insecurity cannot be solved by starting at the big level. It needs to be started at a micro level, right? What can I do in my community? Right? How can I spread that positivity, a solution in my community so that it goes ahead and starts growing? So I think that is what we are doing. I think the foundation level is very important. It's very important to solve the issue, in your immediate surroundings, and then it really starts radiating all around.
Your comments on this statement that we read somewhere, restaurants have lost up to 3 decades of jobs in just 2 months. According to you, what is the method or perhaps the technique to survive COVID-19 right now? If you are a restaurant owner or if you are a bar owner, even you own certain places that work as both, what have you realized has helped?
Aditi, I wish I had a crystal ball that I could tell you that what the solution is. All of us in this industry, in this country, around the world, are still grappling with the fallout of COVID-19. All of us are trying our level best to make an informed decision which is safe for our team, for our guests, and for ourselves. And everybody is coming up with unique ideas. I think with curbside, the basics, just to make sure that there is no contact, curbside delivery. The fact that, simple things like the guidelines which are coming out, which we are following, wearing the mask all the time, which, by the way, when you work in a hot kitchen, a mask it's so stifling, but you've got to do what you've got to do. The fact that there's constant hand washing, there are sanitizer stations all over, there are gloves on all the time. As people are coming in right now, each and every team member's temperature is being taken to make sure that nobody is sick. We are writing logs down, we are asking questions. Again, it is so, it's a work in progress. And I don't think that there is a correct answer for how to survive this. I think the only correct answer is to have the resilience to survive it. Not to get bogged down by it. Yes, I mean, in the scope of our entire lives, these few months it's just going to be a really short span. So everybody needs to look at the longevity of staying, of resilience, and just being smart about each and every step that they are taking.
What is the future of restaurants or food industry looking like? You belong to two very interesting aspects of the food industry. One is television, and the other one is the actual restaurant, ownerships of having various branches, not just one. Where do you see it going? Is it going to be limited people? Will it be limited staff? Will it be, the requirements of masks and gloves and the continuity of that?
I think everything which is happening right now is going to be very temporary, right? The solution is going to come up when there is a vaccine or when there is a cure, right? Nothing is going to be normal before that happens. That's something that all of us agree with. So whatever steps which are being taken, those steps are going to be very temporary. Be it every alternate tables, be it disposable china, be it everybody wearing masks. In the end of the day, we have to realize the reason people go to a restaurant is not only to eat, it is to socialize. That's why the restaurant is a heart of a community, of a society. It's not because of food. You can get food anywhere, right? But the fact is, the sense of belonging, that togetherness that you feel, that you can find in a restaurant, right? It's a social outing. So I think the future of the restaurant industry is going to come back to the fact that we are going to be together. It'll just take time. And we'll have to. I mean, the fallout of COVID is it's so huge. The fact that there is going to be, economic constraints for people to come out. So our recovery is going to be very, very slow, but our recovery will be there. And I think that is something that everybody needs to keep in mind, that tomorrow is not going to be normal. Next year, we'll get on the track of being normal.
New York City, where we are coming from, is on track to begin its phased reopening as number of hospitalizations of COVID-19 cases continue to decline. Today, Mayor Bill de Blasio stated that its reopening is likely to begin in the first half of the month of June. Phase 1 of reopening allows regions to resume manufacturing, construction, as well as agricultural operations, and retailers to open with limitations. This aims to come as economic relief for the city that has been in the epicenter of this disease. Bringing now a perspective on reopening and several aspects of health and economic issues in New York City, we spoke with New York State Assemblywoman Catalina Cruz, who addressed the South Asian American community as well as other immigrant communities.
Reflect upon how COVID-19 has impacted the immigrant communities. You represent District 39. It is super, super diverse. It has a lot of immigrant communities. A lot of essential workers are also working there. Could you tell us how it's impacted that minority community?
Absolutely. Look, in the 39th district, we have Jackson Heights, Corona, and Elmhurst, and Jackson Heights and Corona are actually statistically the top two neighborhoods with the highest number of contagion, as well as top two of the top 10 neighborhoods with the highest number of deaths because of COVID. What this has meant is that people have unfortunately died, people have gotten sick. We have to look at the history of the neighborhood to understand why that has happened. These are immigrant communities that are highly dependent on daily labor. So whether they're at a restaurant, whether they're domestic workers, whether they're street vendors, and lots of these folks have no access to healthcare, have no access to help from the federal government because maybe they're undocumented, or maybe they have another form of status, or we have lots of folks who are taxi drivers, who are Uber drivers, who are working in these industries where you're not necessarily considered an employee. So you may get some help, but not all the help that you need. And that has led to a lot of people ending up this way, sick, unfortunately. One of the other, I think, unique things about this neighborhood is we have some of the highest concentration of people. We are forced often to live in overcrowded situations because the rent is too high, and sometimes it's cultural. Sometimes we want to live with grandma, we want to live with auntie, but most of the time we're forced to live in overcrowded situations because we just can't afford the rent.
Definitely. And so, when I ask you a question about the impact on the healthcare system, then these communities are directly impacted by those. Wouldn't you say that?
I mean, absolutely. In this neighborhood, we have one big hospital. Well, in these three neighborhoods, we have one big hospital, which is Elmhurst Hospital. And many of your viewers may have heard that in the past 2-3 months, Elmhurst Hospital became almost like a daily thing on the news because of the number of people that were dying, because of how crowded it was, because it began operating at almost, I believe, 125% capacity, which is extremely high. And so the healthcare system almost crumbled in our neighborhoods.
Definitely. And then, discussing that, when you're looking at this economic crisis and the healthcare crisis, right now, what is the condition of the hospitals in your area right now in the district? What are the needs, of the hospitals and nursing homes? And I see there's a PPE supply and boxes of those behind you. I would like to know what that is for as well.
So I think it's much better than it was when it began. Initially, we weren't getting enough supplies. We didn't have the support, frankly, from the elected officials who needed to be worried about this. When people realized how terrible it was, we began advocating for more PPE. And so we were getting it from the government, but we were also getting it from donations, which is some of what you're seeing here. But this is actually not that. This is bags that we use to pack food for the people that we feed every day out of our office. Because one of the things that began happening is that we don't have food pantries in our community. So people were going hungry, and we closed down our office to the public, but we opened it up to give out food.
Is food insecurity a really big problem in that area right now due to the economic crisis and the healthcare crisis?
It's a huge issue because if you are doing the kind of work that you depend on it every day, as I mentioned before, if you don't work, you don't get paid. If you don't get paid, you don't eat, and you cannot pay rent. And so people are scavenging basically at different places to see where they can get food because there isn't a lot. So we've partnered up with nonprofits, our neighbors. We had a union drop off a bunch of food today. We are depending on the help of others to make sure that our community is not going to die hungry.
What are some of your current concerns, your major area of focuses right now? Is, with reopening as such a major news, is a concern also a resurge of COVID-19 cases while your area is still battling with it?
Absolutely. I think it would be irresponsible for us to just open it up just like that. I think we need to, this I do agree with the governor, to do it gradually based on the statistics and the numbers that the healthcare professionals are giving us. If we begin to see a steady decrease in the way that it would make it safe for us to reopen, then that's what we need to do. But we still need to do it gradually and with education for the community, so that we don't end up 3 months from now worse off.
What do you have to say about the local as well as state leadership here, especially in New York? You know, we are the epicenter of the epicenter. How do you think all of these leaders have handled this, the city itself?
I think I think many of us have done a really good job at being at the forefront of what the community needed. But I do think that for a while there, some of the leaders at our city and state level spend too much time fighting each other rather than helping people and figuring out who could take credit for the work. And so we're at a point now where no one cares where it came from. No one cares who takes credit. All that people want to know is, can they pay the rent? Can they eat? Do they have health care? And when can they go back to work?
It's time for a short break on Vision of Asia. Voice of the Community will be back shortly. Welcome back. This is Vision of Asia Coronavirus Pandemic Special Report, and I am Aditi Lamba. Now we have an ITV Gold exclusive featuring popular Indian American singer, songwriter Lisa Mishra, who recently joined us for a virtual conversation from India. Lisa Mishra spoke to us wholeheartedly about the ongoing COVID-19 relief efforts in India, helping the migrant workers of India who are truly at the heart of the coronavirus crisis in the country. The multilingual singer has been performing for national fundraisers such as YouTube's One Nation and Facebook's I for India, along with several other platforms, and is passionate about giving back to the ones that truly need. Here is a segment of our interview with Lisa Mishra, where she also discussed her latest single, Nahi Chahida, success, along with her Indian American cultural heritage. Watch the full interview this Saturday at 10:30 a.m.
You have recently done a couple of concerts to raise money for COVID relief, and I think that is so benevolent. You were also in Global Citizen, where you were one of the only 2 South Asian artists performing, and you also did I for India. Talk to me about that experience and what is going on there in terms of artists raising funds for COVID.
Yeah, sure. Global Citizen was awesome because it's an established cause, and yearly they have a different sort of mission as to what they're trying to accomplish and who the funds are going to. This year, the obvious one was COVID, and the goal there was to partner up with the World Health Organization in order to get more PPE kits ready for our healthcare workers. This is very specifically about making sure that we are preparing our medical workers and health staff when they go into work. So that was for Global Citizen. And of course, like you said, it was only one of 2 artists out of India, me and Vishal Mishra, no relation to me, although the same last name. And the 2 of us were just very happy and proud to represent India in that. And with the roster like that, I think it was just like a total dream for me to be participating. And then we did another event through YouTube, which was One Nation. And that was amazing because it was a different format, because YouTube obviously wanted to engage its content creators, specifically 2 really large content creators within India who have almost 10 million or more subscribers. So they had all these well-known internet celebrities and digital creators sort of curating the event, and had a lot of featured artists and comedians coming together to make that one a success. Again, geared towards helping pay for daily wage workers, and we have a lot more issues, I think, obviously, in a country that is developing like India. So we have to also expand beyond our healthcare professionals and be able to help the people who are struggling just to earn a wage and to eat and live and be, trying to just make it through the day and the week as we continue to be in lockdowns. So that was the second one. And then the most recent one we did was called I for India, which was specifically all known faces and artists in music and film of India coming together. And a few, of course, like we had Jack Black come in and do a little bit for us. And this was sponsored through Facebook. And this one was very specifically about splitting between cash for daily wage earners, PPE kits for medical care workers, and food and other resources for migrant laborers and people who've been stranded in cities that aren't their home.
Wow. Lisa, do you plan on doing more of these? Because we are looking at another few months of COVID crisis here. Do you hope more?
I would love to. And I think, you know, time and time again, music ends up becoming a sort of universal healer. Right. In every great crisis, we've always had music sort of play a very important role in uniting people around a cause. And of course, that's where Global Citizen has always done good work. We used to have Live Aid back in the day. That's kind of where all this platform began. So I'm happy to make music as a way to engage people and keep them happy, for one, on the mental health side, you know, kind of just keeping things light and making sure people are entertained and engaged while at home, but also that turns around and provides resources for people who are truly suffering right now, whether it's monetary or medical resources. That anything I can do from the comfort of my home, I'm happy to do it.
Definitely. Lisa, let's talk about music right now, because, you know, it is your expression, it's your narrative, and there is so much work that you're doing. VYRL Originals is the music label that represents you in India, and you've moved from the US all the way to India for this. So before we even talk about your transitions and your messages out to South Asian community, which I have to get, talk to me about your experience with the label. You just had a new song, Chaida. What's going on with that?
So VYRL is part of Universal Music India, and VYRL specifically does non-film Hindi content. So I'm signed to VYRL as one of their artists, and I've done 3 songs with them so far, 2 of which have done really, really well, and I'm so happy that people have really, you know, liked these. And it's interesting in India because we do have such a huge film presence in music, right. And most of the market is gonna, you know, obviously feed off of that. It's about 80% of our entire music market is film music. And that's very unique to India. So this 20% space we're trying to fill with non-film, we've just been very grateful to people for engaging with the type of stuff that we're putting out, because it's unexpected when it does so well. Yeah. So we've had a good run of it, and yeah, that's what I do with VYRL. I make non-film music with them, and Nature, that was my most recent release that came out 2 weeks ago.
You know, let's discuss this a little bit more, Lisa. This non-movie, non-filmy music, which is basically similar to what you kind of were doing here. You know, music here in the US is label-based, of course. However, it is beyond just movies and beyond just films. Talk to me about that experience that you're having in India, creating that niche market, and what has the response been for you?
It's interesting because, you know, everywhere else in the world, independent music is the only form of music. So we have people being the face of their own songs, people being the face of their own art. India, what we have is playback singing and a very deep, long culture of that. So oftentimes what happens is the creators of this work don't get the deserved sort of recognition for their work. And it's not just about recognition, it's just that, you know, it's nice to be able to put a face to a name. And for so long, artists haven't really had an opportunity to do that until the 90s. That sort of had a big change. The 90s was a really great time for Indian independent music. A lot of bands and a lot of like, you know, girl bands and solo artists and things are coming out, which is amazing. But then again, it sort of tapered off in the early 2000s and has carried on well into the, like, you know, the 2010s. So as of about 5 years ago, really, people like Badshah, people like Hardy Sandhu, Arjun Kanungo, these are artists that have really kind of made a mark. Asta Gill, these are people who are kind of pushing that independent music scene forward, which is fantastic. I think it's really necessary. And of course, because it allows you to be the face of the music that you're making, which it's a standard everywhere else on earth. But here we usually have actors and actresses be voiced by a playback singer. So we're trying to carve that market again, because India has done it before, but somehow it kind of faded away in the past couple decades. So they're trying to bring it back.
And that is all for tonight's episode. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from a remote location in New York City. This is Vision of Asia. I am Aditi Lamba. Take care and be well.